Hello and welcome to part 2 of facial bone anatomy. We are going to begin part 2 discussing the zygoma. The zygoma bone, and remember we have one on each side of the face, is attached to the maxillary bone laterally. So in part 1 we talked about the maxilla. So if we move laterally along the face, here is the zygoma. The zygoma bones, which have been referred to as the malar bones in the past, form the prominence of the cheeks and make up the lower outer portion of the orbit. Projecting posteriorly from the zygoma is a slender process that connects with the zygomatic process of the temporal bone. And you can see that relationship here. Remember, that forms the zygomatic arch. The zygomatic arch, remember, is a delicate structure that can be fractured by a blow to the cheek, causing that arch to cave in or collapse. The anterior portion of the arch is formed by the zygoma, which you can see here, and of course the posterior portion of the arch is formed by the zygomatic process of the temporal bone. The zygomatic prominence is a positioning landmark, and the term refers to this prominent portion of the zygoma. The zygoma articulates with 3 cranial bones, the frontal, sphenoid, and temporal, and 1 facial bone, the maxilla. Next, let's talk about nasal and lacrimal bones. The lacrimal and the nasal bones are the thinnest and most fragile bones in the entire body. And we'll talk about the lacrimal bones first. The 2 small and delicate lacrimal bones, which are about the size and shape of a fingernail, lie anteriorly on the medial side of each orbit, just behind the frontal process of the maxilla. So let's kind of take a peek at that. Here's the nasal bone, which we'll talk about more in a minute. Here is that frontal process of the maxilla bone, and we discussed that in part 1. So just behind that is the lacrimal bone, and then behind the lacrimal bone, that is more of the orbit. And we'll talk about orbit anatomy in a separate lecture. The name lacrimal is derived from a word meaning tear, and that's an appropriate name because the lacrimal bones are closely associated with our tear ducts. Next, let's talk about the nasal bones. The 2 fused nasal bones form the bridge of the nose and can vary quite a bit in size. Some people have very prominent nasal bones, whereas nasal bones in other people can be quite small. Much of the nose is made up of cartilage, and only the 2 small nasal bones form the bridge of the nose. The nasal bones lie anterior, superior, and medial to the maxilla, and inferior to the frontal bone. And you can see that relationship on our diagrams. So here is the frontal bone. So the nasal bones are inferior to the frontal bone. And then you can see how the nasal bone is anterior and medial of the maxilla. The point of junction of the 2 nasal bones with the frontal bone is a surface landmark that we use for positioning. Remember, that's the nasion. Okay, let's talk about articulations. Each lacrimal bone articulates with 2 cranial bones, the frontal and ethmoid, and 2 facial bones, the maxilla and the inferior nasal concha. The nasal bones articulate with 2 cranial bones, the frontal and the ethmoid, and 2 facial bones, the maxilla and then the adjacent nasal bone. Okay, next, let's talk about another facial bone, the nasal concha. So within the nasal cavity are 2 plate-like and curved facial bones called the inferior nasal concha. And these 2 bones project from the lateral walls of the nasal cavity on each side and extend medially. And you can see that relationship here. So they project medially from the lateral wall of the nasal cavity. The inferior nasal concha are brown on this diagram and kind of a tan color over here. So there are actually 3 pairs of nasal concha, which you may have gathered from the diagram. The superior and middle pairs are actually part of the ethmoid bone, and that's why they're a different color on your diagram. So they're kind of a pinkish color. That's because they're part of the ethmoid bone. The inferior pair of inferior nasal concha are separate facial bones. The 3 pairs of nasal concha divide the nasal cavities into various compartments, and these compartments tend to break up or mix the flow of air coming into the nasal cavities before it reaches the lungs. In other words, incoming air is warmed and cleaned as it comes in contact with the mucous membranes that cover the concha. So let's talk just a little bit more about the inferior nasal concha for a minute. Looking at the lateral drawing, you can see that the superior and middle concha are part of the ethmoid bone, and the inferior nasal concha are in fact separate bones. And I mentioned that earlier. The superior and middle are kind of a different color here, and that's to indicate that they're part of the ethmoid bone. The inferior nasal concha is a separate facial bone. The cribriform plate and the crista galli of the ethmoid bone help to separate the cranium from the facial bones. And you can see, again, the palatine process of the maxilla, which help make up the hard palate. So if you remember in part 1, we discussed the hard palate. That is this structure right here. So the roof of the mouth. And do you remember on the diagram of the roof of the mouth, there was 2 little parts in purple? Well, those are part of the L-shaped palatine bone. And again, that bone isn't visible on the exterior, so you can only see it on this medial slice. Okay, the inferior nasal concha articulate with 1 cranial bone, the ethmoid, and you can see that relationship here. They also articulate with 3 different facial bones, the maxilla, the lacrimal, and the palatine. Okay, the next set of facial bones that I'd like to discuss are those palatine bones. And again, you cannot see the palatine bones externally. You can only see it on a medial diagram like this. Each palatine bone is roughly L-shaped. The vertical portion of the L extends upward between 1 maxilla and 1 pterygoid plate of the sphenoid bone. And you can see how it extends upward here. The horizontal portion of each L, remember, makes up the posterior portion of the hard palate, and that is what you're seeing here. So this area corresponds to this area. Also, the most superior small tip of the palatine can be seen in the posterior aspect of each orbit, and we'll do a separate lecture on orbit anatomy. The palatine bones articulate with 2 cranial bones, the sphenoid and the ethmoid, and 4 facial bones, the maxilla, inferior nasal concha, vomer, and then of course the adjacent palatine. So these are 2 different facial bones, right and left. Okay, we are going to pause part 2 here. We'll pick up part 3 talking about the bony nasal septum and the vomer.